Welcome to part 4 of the anatomy of the heart and lungs. Now, we were talking about dividers that keep the venous blood away from the oxygenated blood and the atrial blood away from the ventricular blood. So, on this slide, we're looking at the septum between the two ventricles. So, left versus right. Now, if you notice, the septum or the wall between the two ventricles has a muscular part and a membranous part. So the muscular part, of course, is because of the myocardium and the need for the muscles to shut the valves in between heartbeats. And then you have the upper membranous part, which is actually the beginnings of the exiting great vessel. So that's the membranous portion. This just shows that they come from two different parts during fetal development. And because of the fusion or the junction of where the muscular portion meets the membranous portion, this is where defects in the wall are most likely to occur, the so called ventricular septal defects. So, depending on the size of these holes, there may or may not be enough mixing of the deoxygenated blood with the oxygenated blood. The moment there is more of the deoxygenated blood, then that's the time you have the so-called blue babies or the cyanosis, where there is uh, the bluish appearance. Is because the blood is not fully oxygenated as compared to the bright red of a fully oxygenated blood. Though this is just the storybook frames of how the walls developed over time in the fetus. So, while the fetus is in the uterus of the mother, there is no need to breathe air. Thus, it would be logical that there would not be any need for the blood to go to the alveoli of the lungs for oxygenation because it doesn't exist yet. The fetus is not yet breathing. Thus, early in development, there are ways to be more effective, that there is no need for the blood to travel to the lungs, so it goes straight to the to the left side of the heart to be pumped into the systemic circulation. So the wall between the two atria, as you can see, has two holes: the primary hole, or the ostium primum, and the ostium secundum. Now, going to the right side, it shows you that the walls will slowly form and close off these holes between the two atria. And the final remainder, the hole that remains, would be the foramen ovale. So this is supposed to close when the child breathes for the first time. So now there is a need for the blood to travel to the lungs, to the alveoli, to be oxygenated. So that means that there should be no mixing of that deoxygenated blood from the right side of the heart with the oxygenated blood on the left side. So the walls must form and must close off. Now, the failure of those primary and secondary ostia, or the orifices in the fetus, will lead to so-called defects in the atrial wall, as I mentioned earlier. So you can have a uh, leftover holes for the sinus venosus, the ostium secundum, and those walls, those tinier holes in between the two atria. At the same time, the the walls in the ventricular part of the heart may also fail to close, so there may be defects in the walls, so the so-called VSDs, mainly in the membranous portion. Next, so we know that the heart is a muscle, and the muscle has an intrinsic beat of around 30 beats per minute, which is not effective if you're a fully functioning human being. That's not enough blood. So ideally, your heartbeat should be 60 beats per minute, and if you're doing some strenuous exercise, that will rise to 90s to 100s to 120s. especially if you're doing aerobic exercises. Now, the rate of your heartbeats and the strength with which the muscles contract will be controlled by the nervous system. So, for a muscle to be effective, apart from the electrical conduction, which will be discussed last, you need a framework, a scaffolding to hold on to make your muscle contraction more effective. So you have the so-called cardiac skeleton. So this helps the valves from, I mean, the orifices from collapsing. So you have cartilage there around the orifices of the valves and where they connect. It makes sure that they close and make sure that they open when they need to be opened. So as you could see, as as you would have learned from the skeletal system, you also need bone or the skeletal structures to attach to. So the heart itself, which has the myocardium, must attach to a skeleton. And this skeleton is also uh, insulated, meaning uh, it does not conduct electrical impulses. Now, blood supply. Since the heart is a very metabolically active organ, it always needs oxygen, it always needs sugar, it always needs nutrients, and it needs to drain waste such as carbon dioxide back to the lungs to be blown off in exchange for oxygen. So if you know that the left side of the heart works harder, it means it needs more blood supply. So looking at the territories of the coronary arteries, so if you know that the left coronary artery needs to supply a lot more of the heart, as you can see, it supplies both ventricles, so very important for the pumping of the blood into the lungs and into the systemic circulation. It also supplies the septum between the two ventricles, as well as the left atrium. So a lot of the workhorse of the heart is supplied by the left coronary artery. This is why most heart attacks which occur here in the left coronary artery are devastating. So a lot of damage to the heart can occur unless you can restore the blood flow to this left coronary artery. While meanwhile the right coronary artery supplies the right side of the heart. So the right atrium, part of the right ventricle, and some portions of the left atrium and left ventricle, which were not already supplied by the left coronary artery. Right coronary artery, right side of the heart. So it goes in a groove between the right auricle, which is the appendage of the right atrium, and the right ventricle. So it will branch to supply different parts of the right side of the heart. Not so important for you, but just to highlight that while it does not supply the main pump of the heart, it does supply the source of the electrical impulses. So the sinoatrial node as well as the atrioventricular node, so which we will discuss in a while. So 55% of the time the right coronary artery supplies the SA node. Now the left coronary artery, which we know supplies most of the heart and is a very important artery. Similar to the right coronary artery, it has to come out first at the root of the aorta and come out of its aortic sinus and form a left coronary artery, which will pass between the left auricular or the right atrial appendage or the left auricle. So auricle stands for ear in Latin. So that's how it looks like to the anatomists. So it passes between the left auricle and the pulmonary trunk to reach the coronary groove. Now what does it supply? So the left main artery or the left anterior descending artery or the left anterior interventricular artery is a very prominent artery, very easy to see and supplies most of the heart. So most devastating heart attacks are due to a blockage of the LAD. So other important branches of the left coronary artery is the circumflex artery, as well as in 45% of people, the SA node artery. So if you supply blood, you also drain blood. So the heart is no exception, since it's a very active organ. It has a lot of waste to bring back to itself, to bring to the lungs for oxygenation. So the major venous drainage of the heart is the coronary sinus. So it's right there between the atria and the ventricles. So just as we had a left anterior descending artery from the left coronary artery as the main supply, the main drainage of the heart into the coronary sinus is the great cardiac vein. So it drains all the territories supplied by the left coronary artery, and it can be found in the same area where the LAD runs through, which is the anterior interventricular groove. So you would see this looking at the patient from the front, so from the sternocostal surface. Other veins are not so important, but they are just here mentioned for completion's sake. The middle cardiac vein and a small cardiac vein, as well as the posterior vein of the left ventricle. No lecture on the heart anatomy would be complete unless we discuss the nervous system of the heart, which is the conductive system of the heart. So everything has to originate from somewhere. So as mentioned, you can cut out a person's heart. It will beat for a few minutes maybe or seconds at the rate of 30 beats per minute. So the intrinsic heart rate is very, very slow and ineffective. So definitely you need a live brain and nervous system to be more effective. So you need to synchronize the squeezing of the atria as well as the pumping of the ventricles to be effective in supplying blood supply to the lungs and returning the arterial blood or oxygenated blood back to the heart to be pumped to the systemic circulation. So synchronicity is key for this to be efficient. So in some people, if this is not efficient and the the right is beating differently from the left, or the atria are beating differently from the ventricles, this will cause problems. So everything begins in the sinoatrial node, which we know is supplied by the right coronary artery. So where do we find it? It's at the junction where the SVC enters the right atrium. So this is our pacemaker. Without the pacemaker, our hearts would beat less than 60 beats per minute, even beat at 30s to 40s beats per minute, and you would need an external pacemaker, or you need to insert an artificial pacemaker. Okay, so the SA node is the pacemaker, and whatever impulses it has must be distributed evenly and equally at the same time to both atria and the both ventricles. So it passes to the atrioventricular node to be distributed to both ventricles. Now the AV node is located in the interatrial septum. So as we saw earlier, that non-coronary sinus, where the root of the aorta comes from, is dedicated for that. That's where you will find the AV node. So from the AV node, it will now form the bundle of His, or generically we just call this the atrioventricular bundle, which will run now in the membranous part of the interventricular septum. It is the only bridge between the atria and the ventricular myocardium. So for the ventricles to be synchronized, the travel of the nerve impulses must be the same in both the left and the right bundles that emanate from this. So you have a bundle branch going to the right side, right ventricle, and a left bundle branch going to the left ventricle. So sometimes some of you might have abnormal ECGs because nahuhuli yung isa. It means the right bundle might beat after the left bundle, or vice versa. Now, as mentioning, you need a living brain. So a person can be brain dead, but the heart will beat as if the brain still exists because of the nervous system, the autonomic nervous system. So this is for a reason, because you don't need to think to beat faster, or you don't need to think for your heart to be relaxed, although it does help telling yourself to relax to help your heart beat slower. But this should be automatic, thus it is relegated to the autonomic nervous system. Now, the fight or flight system, or the sympathetic nervous system, as you may deduce, speeds up the heart rate. So it acts on the SA node and the AV node to beat faster. At the same time, it wants to provide more blood to provide a stronger pump action. So it increases the diameter of the lumen of your coronary arteries. So bigger diameter means more blood flow, means more blood reaches the muscles of the heart, effectively increasing the cardiac output via increasing the force of the heartbeat. Whereas the part of you that tells you to relax, automatically, the parasympathetic nervous system via the vagus nerve from the brainstem acts now the opposite of the sympathetic nervous system. So it's meant to slow down the heart rate. So it acts on the SA node and the AV node to slow down the pacemaker there. At the same time, it lessens the force of the work of the heart by diminishing the blood flow. It constricts, so it makes the diameter of the coronary arteries smaller, so that there's less blood flow, and effectively reducing the force of the heartbeat. For efficiency purposes, the sympathetic nervous system and the parasympathetic nervous system are bundled together in what we call the cardiac plexus.